Good morning, everyone, and welcome to the Multnomah County Board of Commissioners Board Briefing. Audience members, I want to start by asking you to please silence your electronic devices. For those presenting today, please turn your mic on when you begin speaking so that the green light is showing, and off when you've completed your remarks so that the red light is showing. Before we dive into our agenda today, I'd like to welcome Gina Nickel, who is the Executive Director for the Association of Oregon Counties, or AOC, to Multnomah County. As part of her duty to lead the 36-member organization, Gina is here today to observe our work at the county. So Gina, I'd like you to invite you up just to say a few words, and welcome again to Multnomah County. We're glad you took the time to be here.
Thank you, Chair Vega Peterson and the rest of the commissioners. It's good to see all of you. For the record, as you said, I'm Dr. Gina Nickel. I'm the Executive Director of the Association of Oregon Counties. I'm very, very pleased to be here as I work with all 36 counties. Thank you. I appreciate Multnomah County as I spent my right after high school and college years, many, many years ago, in the 70s here in Portland. I want to thank all of you for the relationship that you have with the Association of Oregon Counties. It takes all of us to work together. Your staff is amazing, and I really, really appreciate not only your legislative staff, but all your staff, and I appreciate each one of you being involved. We've got a tough legislative session coming up ahead of us, and I appreciate the committees that you serve on, not only at the Association of Oregon Counties, but also at NACO, the National Association of Counties, because it's going to take all of us to protect local control, local government, and do the work that needs to be done. I always say we are the boots on the ground for the state, and sometimes we have to help the state recognize that. Thank you for your service, and I'll answer any questions that you may have.
Thank you. Any questions for Gina? Go ahead.
Yeah. I just want to make just a brief comment. It's been great participating in the various retreats and just the connections from the different committee leaders. Just last 2 weekends ago, I spent time with Commissioner Thompson and in Clatsop County, and just the ability to bounce ideas from the various commissioners from the 35 other counties has been helpful for just myself and my office, and we're looking forward to the retreat coming up in June. And thank you for your leadership.
Great. Yeah. Thank you.
I don't have a question, don't worry, but I do have a comment. So as someone who serves on the AOC board, I just want to thank you for often in that room with the 36 counties that have in some ways, very different economies and landscapes and divergence of opinions on public policy issues that you do a great job finding where we have common ground, and when we have common ground, very effectively advocating on behalf of the counties. So thanks for doing that, because I know that's not easy, always wrangling the largest and the smallest and the mix in between, and getting them all on the same page to advocate on behalf of our county's interests.
Thank you.
All right. Well, thank you so much again, Gina. We really appreciate you being here, and I know we'll be talking with you a lot.
I look forward to working more with Commissioner Moyer on reining back in OHA. Thank you.
Yes. Thank you. You'll find a lot of support here for that. Thank you, Gina. All right. Thank you. That was great, and we're glad to have you here. We'll go ahead and move into our first briefing item today, which is our EMS System Assessment Report briefing. I'm really pleased that we're diving deep into this topic today. I would say over the past 2 years, we have had several briefings from our EMS program focused on ambulance contract compliance, system performance, and monitoring the ambulance staffing model change approved by this board in late 2024. During those briefings, we've had updates on a process we launched in parallel to that work, the process of revising our ambulance service plan so that we are addressing both the needs in our system today and planning for how that system should look in the future. Today, we're at a significant milestone for that systems level work. Last fall, the EMS System Assessment Report was finalized and shared with the board and the public with an open public comment period from December to March of this year. That report reflects months of in-depth work performed by a third-party subject matter expert in EMS systems, interviews, ride-alongs, and field observations, data review and analysis, and the application of best practices in EMS to deliver a comprehensive assessment of our system as it stands today. It gives us a strong foundation to understand potential reforms to support a stable, high-quality ambulance response from our community. Today, we have our EMS Administrator, Erin Monig, to walk us through a synthesis of these three key things to help us move from assessment of the system to action. 1, the findings and recommendations from that report. 2, what we've heard from the public on that report. And 3, the expertise of our EMS team focusing on what rises to the top as we draft a revised ambulance service plan for Multnomah County. I appreciate all of the work that our EMS team has done to take a huge amount of information and bring it to this board in a way that is understandable and actionable. I also want to thank, we have many people in the audience today who are here to hear about this report, who participated in this, and I want to thank them for their attendance as well. With that, I will turn things over to Erin. Good morning.
Good morning, Chair and Commissioners. Could we get the, yeah, oh, wait. Good morning, Chair and Commissioners. For the record, I am Erin Monig, EMS Administrator. Today, I'm providing a formal briefing on the EMS system assessment, a critical milestone as we move towards a comprehensive revision of the county's ambulance service plan, or ASP. We started this project in 2024, earlier than the normal review that would have occurred due to a persistent issue with the current system. The normal process would have started this year, 2 years prior to the end of the contract. The current ambulance contract ends August 31st, 2028, requiring several actions. 1 is confirming or revising the county ambulance service plan. Next slide. Our objectives today are threefold. First, to provide a baseline of our current system oversight. Second, to synthesize the findings and stakeholder feedback from our recent assessment. And third, to outline the process by which this board will evaluate and eventually adopt a revised ambulance service plan. Next slide. Our mission remains the delivery of the right care at the right time. In a county as geographically and socioeconomically diverse as ours, this requires a system that is not only clinically excellent, but also structurally resilient. Emergency medical services sits at the center point of public health, public safety, and healthcare. Next slide, please. This diagram shows the high-level components of a traditional EMS system: call taking, triage, dispatch, response, treatment, and transport. Everything I will be discussing today lives within the circle on this diagram, specifically the components, potential changes, and options for how the system is designed. Next slide, please. To ensure a productive discussion, it is important to define our lanes. The county's role is statutory and that of a regulator and system lead, set by Oregon Revised Statute 682. We supervise medical care and regulate quality, coordinating with city partners for triage, dispatch, and fire private partners for field response. Next slide, please. This slide shows foundational service elements of our county system. Our oversight is organized into 5 functional pillars: medical direction, call receipt and medical dispatch functions, first response, ambulance transport, and funding. The assessment we are discussing today looked at each of these pillars, both individually and as an integrated whole. Next slide. In 2016, we grounded ourselves in these foundational service pillars. Today, we are questioning everything, even these foundations. 2 of these are non-negotiable. The state determined we may only have 1 transport provider per geographic area, known as an ambulance service area. And the county is obligated to ensure no service disruptions. Next slide. I want to provide full transparency regarding the stewardship of this project. As a county, we are required to ensure an effective and efficient ambulance service system and have a written ambulance service plan. As previously stated, we started this process to be a thorough review of where our system is at and what opportunities and barriers we have. We secured a specialized contractor for a total contract of $465,000 for the duration of the project. Actual expenses to date are in the hundreds of thousands, not millions. As a county employee, I have no conflicts of interest. My only interest is the quality of service this community receives. The EMS program's programmatic role is to inform and advise in order for the county to fill our statutory role of confirming or revising the ambulance service plan and addressing any structural system issues that can address persistent system deficiencies. Next slide, please. This timeline captures the transition from procurement of our consultant through a competitive process to today. We have concluded the public feedback period as of March 5th, and we are currently at the synthesis milestone. Following this briefing, we move into the drafting phase of the revised ASP. Next slide. The assessment revealed 4 core findings. The paramedic shortage is a structural reality. Medical direction can be structurally strengthened. Our technology is siloed, and our system complexity requires more centralized coordination. And lastly, our funding model is fragile. Next slide. We received 8 formal responses from a range of stakeholders, including clinical providers, municipal leaders, and the Bureau of Emergency Communications, BOAC. We have filtered these recommendations and feedback through an impact cost feasibility matrix to bring options specifically related to the ambulance service plan requirement that offer the most significant system improvements. Next slide. In synthesizing stakeholder responses, we applied this cylinder metaphor. Our partners from labor to city managers often see different shadows of the same system. One sees a circle, another a square. Our job is to validate those perspectives while keeping our eyes on the whole cylinder, the total system. Next slide. When I say system today, I mean the entire network. Dispatch centers, fire agencies, ambulance providers, and the healthcare system that receives patients. This is a multi-dimensional object that looks different depending on your role. Next slide. I want to thank those who provided written feedback. While the report includes broad healthcare items, today we will focus strictly on the statutorily required elements of the ambulance service plan, specifically the service area components. Next slide. The board plays an essential role in determining policy within the state structure. Emergency medical services sits at that intersection of public health, public safety, and healthcare. And in Oregon, the specific authorities for approval of plans lies with the Board of County Commissioners in each county. You must distinguish between descriptions, geography, population, required acknowledgments to decisions the state has already made, and decisions, how calls are triaged, dispatched, level of care, and staffing. We are at the point that we need to focus on some decisions related to how the county's EMS system is structured. Next slide. This slide outlines the high-level service elements of an ambulance service plan that I will be talking about today as they are core to the ambulance service plan. Next slide. Ambulance staffing. Next slide. Some background about care levels available in the pre-hospital setting, as not all care is the same. Paramedic level care, also called advanced life support, is the highest pre-hospital level recognized, with extended training and more invasive treatments available. These care levels are defined by both the trained personnel and the specialized equipment and medications they carry. So this care is a combination of the licensure of the people, supplies, equipment, and the vehicles that arrive on an incident. Next slide. A little more details about the people, the training and experience. While all of these individuals are technically ambulance drivers, there's a specific distinction between the people and those that can solely drive an ambulance. State standards permit basic life support ambulances to operate with a qualified driver. A qualified driver is an individual whose primary training and qualifications is the ability to drive an ambulance. The lowest licensure level of a person permitted to provide pre-hospital medical care is an EMT, or emergency medical technician, who can provide non-invasive treatments such as splinting and bandaging. Paramedics in our system have been credentialed as basic paramedics, which are paramedics with a state license who have no demonstrated local experience or Multnomah County specific training. And lead paramedics, individual possessing a paramedic license who have demonstrated a year of county experience, have successfully taken county training for low frequency, high consequence procedures, and expanded use of medications, clinical procedures, and local protocols that are only available through these advanced care paramedics. This graphic shows the high-level difference in training and experience between EMTs, paramedics, and the advanced care paramedics, who perform specialized procedures like surgical airways. Next slide. One of the questions we must ask, how much flexibility should the provider have? Not every emergency response requires a high-level emergency medical provider, but we must balance that with the need for enough units to be available. There are many ways to get the various providers all to the appropriate scene. When a fire engine or advanced life support ambulance arrives today, that unit comes with an advanced care paramedic. The fire departments have rigorous probationary periods that last for a year, with frequent evaluations and mandatory attendance at these county-required expanded trainings. Before the newly hired paramedics work without another paramedic, they have demonstrated that mastery of knowledge, skills, and ability, and actual evaluated performance in this system. Though these paramedics do not routinely ride in on every high-level ambulance transport, as that is not the fire department's only function in local public safety. Next slide. The report recommends a permanent paramedic EMT hybrid model and makes a separate recommendation to augment with advanced care paramedics in quick response vehicles. Next slide. Field staff expressed concerns that current hiring practices involving paramedics with little experience, reduced orientation, leading to critical errors, and a concern about resource utilization in an already paramedic-dense system. Next slide. There are options. Have basic life support and/or hybrid ambulances and dual-staffed ambulances, with all ALS ambulances staffed with these lead paramedics or advanced care paramedics like we do today. Implement a BLS and hybrid ambulance model with the addition of the advanced care paramedic not on the ambulance, and there is always the option to go back to 2 paramedics on an ALS ambulance. Next slide. There's a mix of cost savings and focused costs in deploying lower level operating ambulances and augmenting the level of care by a smaller focused pool of advanced care paramedics. This addresses the issue of how many paramedics are in the system by focusing the experienced paramedics to running and transporting the higher acuity patients and going on the ambulance for transport when necessary, or clearing the calls and being more available for the next call. This both addresses the shortage in the short term and offers flexibility should that dynamic change for better or worse. Given the recommendation, feedback, and clinical care implications, the recommendation is to shift the thinking and requirements to a paramedic and advanced care paramedic on all calls dispatched as a critical call to ensure appropriate clinical care is available to these patients, to permit innovation and partnerships at how the staff arrive to the scene in addition to the ambulance, and ensure the appropriate clinical level provider attends patients during transport in the ambulance. This has numerous possibilities of how these staff arrive on scene, whether those advanced care paramedics arrive by a non-fire department operated quick response vehicle, or through a partnership with fire agencies or city jurisdictions. Many patients, when physically evaluated, are not critical, and an emergency BLS ambulance is appropriate. And many ALS calls are also not critical, but require advanced level care that a state licensed paramedic is absolutely capable of delivery. There's a percentage of calls that absolutely require the advanced knowledge, skills, and ability of an experienced advanced care paramedic. So the recommendation here again is set appropriate care levels and number and types of personnel, not that the personnel be required to be exclusively on the ambulance. This is getting the right care to the right patient, permits agreements with first response agencies wanting to be part of that continuum of care without requiring them to do that, and gives a pathway to plan and address cases that agencies do not want to respond to. Next slide. Next element, ambulance service areas. Next slide. Ambulance service areas are not the same as fire service boundaries or fire protection districts. There are some specific requirements that the state has already defined in Oregon's revised statute 682. We need to have at least one area, and the entire county geography must be accounted for. Our county is not necessarily unique, and we need to recognize a significant portion of Multnomah County's geography falls outside of a fire protection area or district. Areas of the county east of the Sandy River are uniquely covered by Corbett Fire, but include substantial federal protected areas with no day-to-day formal fire or rescue services. On the western edge along Highway 30, outside of the city of Portland, are provided services from Washington County and Columbia County. Our county receives what has historically been classified as mutual aid in these areas, from Cascade Locks, Scappoose Fire, Tualatin Valley Fire and Rescue, and to the south, Riverdale and Dunthorpe from Lake Oswego and Clackamas AMR. Our county has one official area and has automatic first aid to areas that receive closer coverage from neighboring jurisdictions: Cascade Locks Fire and Ambulance, Scappoose Fire and Ambulance, and Lake Oswego Fire and Clackamas AMR. Next slide. The report recommends maintaining a single service area for 911 response to ensure coordination, but updating maps to align with state-defined urban, suburban, rural, frontier, and search and rescue footprints. While only a small mention in the findings report, we have added it here. Next slide. The feedback that was received is that the East County cities perceive the current model has functionally made the fire department the primary responder. Next slide. Options are to maintain the status quo, one ASA, or divide the county into multiple ASAs. Next slide. I don't want to downplay the implications here. Any split or division of the county would cost more. Each area would be required to have all of the same infrastructure and fail-safe provisions as an independently operated contract. These are fixed costs, not scalable. It doesn't cost less just because it has less volume. Typically, multiple areas are recommended or supported when there are geographical or structural barriers that support creating a separate operational unit, divided or isolated. Multnomah County is diverse in our geography and communities served, but there are no fully self-sufficient isolated locations. This brings with it fragmentation and increased resources to monitor and support. It is not without potential benefits. There is a potential redundancy and potential added capacity as each ambulance service area would need to operate independently with increased overall resources. The smaller east cities and Gresham sit between the core urban areas of Portland and a large swath of unincorporated Multnomah County's eastern suburb, rural, frontier, and search and rescue areas. There's one hospital in East County, and it is not the primary destination of ambulance transports. The transport durations are longer, and the return to service areas would add extensive time to ambulances solely servicing the east area. The program recommendation is one. Should this not occur, there needs to be sufficient protections should multiple RFPs not result in vendors, or a vendor or service fails that the county can meet the non-negotiable requirement in the pillars of no disruption in services. Next slide. Interoperability. Next slide. The next several slides talk about some technical systems of information that are used by medical direction, the county, and agencies to understand what is occurring in the community. These systems are not interoperable, are siloed, and lead to different levels of understanding of the system. Use of the city's CAD is helpful, as is one system. That system, however, does not meet the needs of an ambulance agency with a dynamic deployment model to move and pre-position ambulances to be in position to respond to calls, and does not meet the needs on the financial side of tracking billable calls for service. Likewise, the charting system used by ambulance agencies meets their clinical requirements for legal compliance, billing, and ambulance reporting, but does not meet fire agencies, who have different requirements for recording as a non-transport public safety agency. To compound things, the self-selected patient care reporting of ambulance agencies and fire agencies do not talk to each other. This limits and increases the ability to complete required legal reporting and billing. Standardizing a single system will benefit some and hinder others. Fire agencies have had the ability at no cost to use the patient care charting system of the ambulance provider, but have not done that. Next slide. The report recommends required interoperable systems and that owners or operators of those systems must abide by interoperability standards set by the county, limiting choices to only systems that can and will talk with each other. Next slide. Feedback supports the finding that there is frustration that these systems are not interoperable. Next slide. Options include doing nothing and knowing the systems are inefficient, cause frustrations, and limit common operating understanding, mandate interoperability standards, build a health information exchange to bridge existing silos. Next slide. The first implication here is it addresses frustration of the users of the system that have not been addressed. There is a high upfront cost as agencies will need to work with vendors to meet the interoperability or replace systems that will talk with each other. There's a significant risk that some agencies' reporting or tracking needs are not met. The benefit of each agency having information that they control and talking with partner agencies and quality assurance and quality improvement is significant. The program recommendation required interoperable systems and that owners or operators of those systems must abide by interoperability standards set by the county. Next slide. Medical direction. Next slide. Legally, we have one responsible medical director, Dr. John Jew. However, we also utilize a team of associate medical directors for quality assurance and protocol development. Next slide. The recommendation is to transition to a more system clinical leadership role. With over 2,000 active providers that staff nearly 100 licensed ambulances, the current span of control is stretched. The report recommends a formal Office of the Medical Director with a unified group of EMS medical directors. Next slide. Several agencies voiced that they would like an agency-level medical director for agency-specific issues, and the constraints of a single person responsible for all aspects of their medical system does not always result in their highest issue being addressed. Next slide. Options include the status quo, a unified model with agency leads reporting to a county or a coordinated liaison model. Have one, have multiple in different structures. Next slide. A unified model increases capacity, responsiveness, and reduces medical errors during handoffs, but comes at a substantial cost to agencies for increased physician FTEs. We have multiple EMS medical directors now. The program universally supports a more formal Office of the Medical Director, including EMS agency medical directors who are employees of the county and operationally and management-wise report to an EMS county medical director. There are still benefits to having EMS associate medical directors working on functions, not just agencies. Generally supportive of making this structure change with the added piece that functionally this operates as one system of care and that requires an EMS system level medical director to deconflict varying and sometimes conflicting interests. There is also a limited number of physicians that meet the requirements to be a state credentialed EMS medical director. Functionally, there's a limit of how many are available. Next slide. First response. Next slide. Fire agencies currently respond to roughly 64% of calls, but they are primarily funded for fire suppression. The report recommends formalizing a tiered response with required metrics for speed and quality of the first response agencies, not just to participate at the level they choose. Next slide. The system currently allows agencies and cities to participate as they choose. First responders are reportedly choosing not to ride on transports that are critical in nature. Cities will not accept a change to this without corresponding funding. Next slide. We have choices: status quo, change nothing. Cities and first responders choose what level and to what extent they will participate in the EMS system and can alter or change that at any time. While already permitted in subcontracting, explicitly identify financial and contractual obligations for first response and agencies' operations relating to quality and speed performance metrics. Next slide. county is not in the correct position to negotiate what the cost of benefit is of this as the oversight agency. The cost and benefit need to be specifically identified by whomever is the ambulance operator and ensure an appropriate fair market value for first response, quality, and operational participation. There's a program recommendation to be explicit in inclusion of arrangements that can be formalized for jurisdictional first response agencies in bringing both quality of care and speed of care to the ambulance services. Next slide. There are consequences to altering these foundational pillars. We are not focusing on flashy items like nurse triage yet because we must build a strong foundation first. Writing the plan is the easy part. Ensuring it can be funded and executed is the challenge. Next slide. This slide outlines the high-level decision points that directly impact all of the components of the ambulance service plan. First, the county currently has explicitly no direct subsidy to the ambulance provider in our current system. Our current funding is unsustainable. 77% of our system users have governmental insurance, Medicare or Medicaid, which pays set rates below the actual cost of service. Because the cost shift falls on a shrinking number of commercial payers, simply raising rates is no longer a viable option. Next slide. The report recommends addressing the structural deficit by acknowledging the failure of the user fee model. We must move towards modernizing subsidies and funding the system at large as a public utility or a service district. For a system the state has already recognized as an essential service in Oregon. Next slide. Stakeholders emphasize that the paramedic shortage is actually a funding shortage and believe without a new funding, the de facto cost of EMS is being pushed onto local fire departments. The current model put a disproportionate burden on the shrinking commercially insured payments from patients. Feedback indicates that all partners are reporting some level of financial strain. Next slide. We have three options. Option A, an enhanced fee-for-service model, includes higher fees and pursuing any additional way to collect additional fees, ground emergency medical transport, or the private equivalent quality assurance fee. Option B, a direct public-private subsidy from the general fund. Or option C, explore a dedicated EMS service district for a stable taxing base. There may be other options, but these are the ones that have been identified. Next slide. The county has had an explicitly unsubsidized ambulance system. Without a funding shift, we will continue to fall below the community expectations for emergency medical services. Reliability, quality, and speed are directly related to the funds available. The program recommends determining a sustainable, subsidized model that takes all EMS partners into consideration and not relying solely on ambulance transport fee for service. Next slide. Service elements, what the program recommends. Tiered ambulance augmented by dedicated advanced care paramedics. Focus on who we want on the call, not on how they get there. One ambulance service area. A formal medical director structure. Interoperability standards. Robust first response that includes not just the fire department, but non-fire quick response vehicles. Address funding. Next slide. This diagram shows the system should we do all of the recommendations. The black boxes represent what we have today, while the blue boxes represent new recommended components that include BLS and hybrid ALS ambulances, advanced care paramedics, and agency-level medical directors reporting to a central county medical director with one ambulance service area. It's complicated, and it's okay that it's complicated. So I know there are going to be questions, and I know that this looks complicated. Next slide, please. Looking ahead, the program, with technical assistance from healthcare strategists, will draft a revised ASP in May and share that draft with you in June or July, and aim for the formal ordinance approval process in late 2026. The new plan would be fully implemented by September 1st, 2028. Next slide. Thank you for your time today and for your participation in the discussion on these foundational elements of our safety net. Next slide. In front of you, you have the high-level groupings of required components of an Oregon State Ambulance Service Plan. The state has recently convened a Rules Advisory Committee to potentially update or revise the rules. Our process has some deadlines related to our contract with AMR, so this process needs to go forward, and we should be prepared to make revisions in the future should the rules change. I am now happy to take questions or hear from the board's initial thoughts on these decision points.
Thank you so much, Aaron, for walking through all of that. And I know that, and you know, this was a really in-depth slide presentation, and yet the report itself is, you know, chock full of all the details of what you just walked us through. So just appreciate all the work that's gone into this. I know that there will be some questions and comments, and obviously we're going to have opportunity later this summer for further discussion. But just to start us off, I'll open it up for questions with Commissioner Moyer.
Thank you. And thank you for your report. Sobering to think about. Questions related to some of the foundation you were setting based off of what's happening now in a workforce shortage, potentially being caused by insufficient revenue stream. My question is, if the private sector or private insurance is a shrinking portion of the payer mix, what conversations have been had with the Oregon Health Authority related to the sustainability of ambulance service if Medicaid is a bigger portion?
I am not in those conversations, but I do know that the Oregon Ambulance Association, along with the Oregon, the medical section of the Oregon Fire Chiefs, are frequently having those because they are the ones receiving that revenue. It's not just at the local level, though, right? Medicare is federal dollars. Our Medicaid payments are higher than Medicare, and so it's even a bigger problem at the federal level. And then some of the programs that they've put in place over the last 7 to 8 years, the ground emergency medical transportation and the quality assurance fee program for the private side are helping fill some of the hole. But even with those programs, it's just not there. It's not getting the federal funding trickling through to be paid.
One option was a local taxing district. Are there any areas in Oregon that do that? And if not, do we have some sample jurisdictions outside of Oregon that
are ambulance service or EMS service districts?
Yeah.
There's an EMS ambulance service district in Eastern Oregon. So there's at least one in the state. Jefferson County had a county-based one that did county money. So there's some models across the country of that. Again, I don't know, I am not the expert on what that does to adding another taxing service district to jurisdictions tax, right? We have some pretty specific limitations that cause tax compression. So it might fix one person's problem and create another one. And I think we're going to need some expertise on which one of those models makes sense.
And then my last question just had to do with the issue of who responds to what calls. How would a process to kind of either tier, or I'm not sure how we would approach that, how does that typically happen when you have multiple partners?
So the current process is the medical director makes a recommendation based on the expected critical nature of the call. A recommendation, if it's a critical call or is going to require multiple resources or special tools or multiple people, would be to recommend to the first response agency that they also respond, and then they make a decision. The fire chief actually holds the authority to decide, and if they decide they're not going to respond, the county makes the decision for which ambulance and what kind of ambulance goes. So recommendation, one agency makes a decision, and that impacts how we make the next agency respond.
Okay, thanks.
Thank you. Commissioner Singleton.
Thank you so much for the work that's gone into this. I think my questions around the staffing always come back to what is the feedback from the frontline folks. And so if there's any info you have there, I'd love to hear just what are the people, some of them here, that are actually implementing the work. How are they feeling about the staffing model and the recommendations as they're shaping up?
Yeah, I don't know that anybody that's sitting behind me wrote written feedback to us, but we did get some, and it was conflicting, or again, I think it's that we have a fair number of paramedics in the system. Sometimes I have too many, sometimes I don't have enough, and I just want to do my job and have what I need. I think what we're trying to add here is some flexibility that ensures that you have the right person and the right number of people. And I look forward to getting more feedback from them about whether this addresses those concerns about having the right person and the right number of people.
And is that a part of the plan as the draft gets developed, is to have more of those conversations?
We always get feedback, and we're always trying to share what that vision looks like. And again, when you read it, you may read one thing where the intent or setup is something else. And so, again, I hope today's briefing also sheds some additional light on what we think that looks like.
Definitely, it does. I think one of the things last time we talked, there was also a retention piece around this that was happening, where it wasn't just not being able to hire new folks, but also losing folks who are paramedics, and just curious how retention has been going.
I think retention is actually getting better. Again, we tend to see a fair number of people turn over as they go to fire agencies or move on to other systems. But in general, the number of people out on the streets that agencies have has slowly been increasing, although it takes time to get experience. So in order to have a year of experience in the system, it means you had to be here for a year. And so that is a holdup, that's a gap. So we can't have more frontline ALS ambulances till we have more advanced care paramedics, lead paramedics to put on those to have the right level of care. And so we're waiting for those newer people to get that time and seat.
Thank you. And this may be a much longer conversation, so please feel free to say that. The data piece seems like it's a really big challenge, but it also doesn't sound like everybody's in, because people need different data elements. Getting to one system seems complicated.
I think that is a very long conversation to have. I think it is very important because it is one of the reasons that fire agencies, for example, see the system as what they have the data on. The portion of, we go on all the calls, we go on all the ones that are in our system, and then we look at the ambulance and they go on all the calls they go on. And then not having the system side by side adds a missing piece. So it's important, and again, it's not going to meet everybody's needs if we do it.
Thank you. I think I'll just close with, it's going to be really important to me that we're talking about these options that are recommendations, that are best practice, but that we also are able to drill down more into the actual cost so that we're able to make those decisions. I don't want to put forward an ambulance services plan that we have no way to fund. It doesn't mean that we don't need to put something good together, but it seems like there's some trade-offs that have some different costs that will need to be considered. So I'm not sure, Chair, if the plan is to do some work sessions and kind of dig into some more of the detail, but I definitely would love for us to have space to get some more detail into this broader overview that you've given us today.
Yeah, and we'll have conversations this summer as the recommendations are fleshed out into the updated plan. So definitely time for that. Commissioner
Thank you so
Broome-Edwards.
much. I always appreciate your work, so thank you.
Thank you. Commissioner Broome-Edwards.
Thank you. I appreciate that the report has been brought to this commission. This has been an issue that throughout my tenure on the commission has been quite concerning, primarily given the impact that this has had on county residents, especially those in East Portland and East County. So I appreciate the commission that this has been brought forward and the timeline. I'm looking forward to a much more in-depth conversation going forward. I understand that frontline staff were consulted and ride-alongs happened during the compilation of the report. I want to thank the staff, the paramedics and the EMTs who are working 24/7 across the county under very challenging circumstances, and I think this report documents that, and they have been for some time. This isn't a new thing. I want to thank the frontline staff for being there for county residents and acknowledge the long shifts that have come with the service challenges that we've had, and that the need to shift posts as ambulance are dispatched means that there's been missed breaks and other sacrifices on the behalf of those who are providing service to the community. I really encourage the county staff as you're revising this, so moving into this next step, that you continue to engage with frontline staff around the changes that are being proposed, and also that the staff and partners at our local fire departments, as you noted in the report, there is this, this is the ambulance service plan that we know, and we've heard from the fire departments and fire staff, the impacts that whatever happens with the ambulance service plan will have impacts to local fire departments. So I hope they're integrated. Just a comment overall about the report, and again, I hope as we move into this next phase with the ambulance service plan, the funding is important, and many of the changes that are highlighted that might be needed, the impacts are mostly outlined in terms of costs, which of course are important, but the impacts on patient care and those being transported is not given equal weight. And I think I want to make sure that we sort of keep that front and center, so that it's not just about the cost, so that we know sort of what the impacts on those being served are. And I will have some questions, but I would appreciate understanding. I think some of there was some significant public comment provided, and some of the responses to issues raised is embedded, I think, in your presentation, but I would appreciate where there's specific issues that have been raised by public commenters to understand what the response is. So generally, question I would have it, I think the assessment report highlights the immediate need for corrective action, long-term structural reform, and I think you've highlighted that out and highlighted how complex the system is with all those blue and black boxes, and what our options are. I'm going to just share what my sort of priorities will be when we see the revised plan. The response to the delays, again, this is very much the case in East Portland and East County, multi-years of noncompliance. Second, another issue, a very important issue, would be declining care quality, looking and missing key performance indicators that we have built in, the significant stroke and cardiac response deficiencies. I'm going to be interested in how you're addressing the oversight and transparency gaps that occurred. The performance accountability, I think in this current contract, there is performance accountability built in. It doesn't seem like it's been effective if we have accountability for the provider to meet response times, and yet it doesn't seem that those accountability measures have been impactful or resulted in the response we would like, which is improved and meeting, frankly, the response time standards. Questions I have. We've known since 2022 that response time compliance is failing. What specific changes under this plan would ensure more accountability going forward? Or is that to come?
Well, I think that's a piece of the contract, not entirely the ambulance service plan. The ambulance service plan had some rigid components in it currently, and this recommendation adds some flexibility, which should ensure that there's more resources out on the road to be able to address that. So I'll have to, I guess, get back to you at where that lives, because I believe it lives in our procurement for the services and the actual contract for services, not in the ordinance or plan. Consequences are not one of the components in the state plan. So we have different elements, right? We have the ordinance, we have supporting code, we have contracts, and we have administrative rules. So we have a couple of different components besides the one I'm talking about today.
Thank you. As you develop the ambulance service plan, I'm noting that the EMS Advisory Council wasn't significantly consulted up to this point. Will they be consulted as part of the development of the revised plan?
Will the EMS Advisory Council be consulted? I can get back to you about where they would fit in. Again, I don't know exactly where the plan is, the draft plan is going to be circulated, and how we're going to take additional feedback on it.
I believe that plan is that advisory council is an ordinance, and they, I think there was a long delay in them getting created, but it seems like they would be a resource and providing some independent advice and counsel as we move ahead. They've got experts on it. It looks like that's what their purpose is, that was originally in the original creation. So cardiac and stroke outcomes remain below regional peers. What, as we're looking at, we're not going to have a new ambulance service plan implemented until September 2028. What is the plan to both improve response times and clinical quality in this transition period?
Yeah, so that's the parallel track where we're working with AMR through the settlement agreement and Dr. Neth related to quality assurance and quality improvement. And so that's a parallel track of work that's going on, where we're trying to get speed and quality back up to where we need to go, given the current constraints, and working for a longer-term solution of what that looks like through this ambulance service plan revision.
Yeah, I'd appreciate, just given the impacts on District 3, to understand as we go through this process what that alternative path is, just because we're not going to see a change in the plan until September of 2028.
Can I jump in? In response to that, to answer your question, I've heard the response times were like 20 minutes or 30 minutes from our fire department in East County, and they've gotten way better since we've introduced, additional, since we changed the model over the last year and a half. So hats off to Mr. McDonald and team, and to the board actually for pushing that forward. And that's in East Portland all the way out through the rest of the district. I've heard that directly from our firefighters in Gresham. So thank you for your flexibility and for the work on that.
I appreciate the work they've done. We've made
You guys have done
improvements.
together, yeah.
We've made improvements in the speed. We've had quality issues. Again, we need to address quality and speed, and I think that's one of the recommendations moving forward is we also want quality and a certain amount of speed long-term based on our current experience.
So you can provide what you're doing in the meantime?
Yeah.
Okay, perfect. And I have some other questions I will submit for the record. They revolve around the staffing model and workforce, system design and governance, and clinical quality and geographic equity. I think we all want a fast, high-quality response, and to know that the system we're designing and moving towards does actually deliver that. Thanks.
Thank you, Commissioner Jones-Dixon.
Yeah, thank you, and thank you, Mr. Melnick, for being here, and your trusted partner that's back there as well. And for everyone that's in attendance, thank you for your service and the level of care that you provide the community. Just two comments. You mentioned the ambulance service areas. I would love to learn more about just, you said that there are pros and cons to splitting that up, specifically to Commissioner Brim Edwards' point, just as far as the different districts and the challenges and as far as health challenges and things like that. It would be interesting. I'm interested to learn more. And then per usual, just want to ensure that not only AMR is at the table as far as providing feedback as far as the frontline experience to Commissioner Singleton's point, same with the fire unions as well as far as their input in the smaller cities too. And then I'm curious how the plan, it seems like we're ahead. The state has the House bill, the work that Representative Graber was leading around the EMS monitor, I can't even pronounce the word.
EMS modernization.
There you go.
Yeah.
Yeah, it looks like we're on track, and the work that we're doing feeds into just like the state standard.
Her work is primarily focused on modernizing the state committee structure and updating state structure. And they credential EMS providers, they license ambulances at the state level. So the work is in parallel, but it's not, it doesn't entirely overlap.
Okay.
We have some responsibilities that are more operational than what the state has addressed.
Okay. Great. Well, I don't have any other questions at this time. Can we ask AMR if they have anything that we should consider, anything to add?
We're focusing on our folks right now, and we've got another long presentation. So but we can always, we're always welcome to hear from folks, and we really appreciate them being today. And I think we can do some more follow-up as we're looking at bringing this issue forward as we take a look at what's the proposed plan over the next several months.
Got it. Great. Well, thank you.
Thanks. Thank you. Thanks. Yeah, no, and I will just say, because I know this has come up, like the input of all of the folks who are impacted by this system, who are participating in this system, who are partners in this system is really important. And I know that work has happened. I know, for instance, like MSAC was interviewed by a healthcare strategist as part of putting this report together, as well as other partners. So we want to continue to do that and have opportunities to hear from folks. I also think it's really important to just to reiterate that this work that we're talking about today, looking at the future state of the system, is really provider neutral, right? Like this is about what the system needs to look like, regardless of who is providing those services. I think that's something that would come out after, the work is being done, the RFP's gone out, and a decision is made around that. the things that we have also been talking about in terms of the response times and what, the system looks like geographically, all of that is available on the dashboard, and, folks can take a look at that and see how that is progressing. I haven't had any requests to do another board briefing on that, but if the board's interested in that, we could take a look at that as well. But overall, I just really appreciate the work that has gone into this today. I think that we have seen a lot of impacts to our system that are symptoms of what is the way that the system is set up. And I think that I really appreciate the pillars as they were discussed. I mean, I think if we look at the share of information because of the way that our data systems are or are not working together, the how decisions are being made, how the medical director role and what that could look like in order to have a cohesive and responsive system, and looking at the really all-important makeup of what is the response for ambulance staffing and that system. All of those are like just key pieces of the bigger system, but we really need to figure what that looks like so we can understand the costs, and then how are we going to really model that. So I appreciate all of the options that you brought forward to the board today. I'm looking forward to more conversations about this as we move on. But I just really want to thank you, Aaron, and your team for all of the work that has gone into this, and more to come.
Thank you all. A question about, and I should ask this for my question for your time, but did you want us to provide specific feedback on the options? I mean, not now, but was that an expectation?
I am happy to hear from each of you offline, not necessarily here.
Yeah.
I am happy to take your feedback directly so that we can figure out how that fits in with what we've heard, what's been recommended, and if you have something that is not what was recommended or what we recommended, I would also like to hear and understand that.
Great.
So your perspective, being the one who has one of the ones that has to ultimately approve the policy, is important for us.
Great, thank you for clarifying.
Great. Thank you. All right, thanks so much, Aaron.
Thank you.
Now we're going to, and thanks everyone who was here today. More to come on this. We'll go on to our second briefing topic today, which is the Preschool for All PAG and TAG recommendations briefing. So I know we have several folks who are here today to talk about this. I will say that this is overall a very exciting year for Preschool for All, as the program anticipates nearly doubling in size, which means that we are going to be providing thousands of additional children access to a joyful preschool experience and their families much needed economic relief. As the program continues to grow, we are continuing to explore what, if any, adjustments are needed, which brings us to our next item, which has been a long time in the making. The ballot measure that voters overwhelmingly passed in 2020 to establish Preschool for All included language that an advisory group would be formed in part to determine if a 0.8% increase in the marginal tax is necessary to fully fund the program. Today, our board will learn about a set of recommendations made by a majority of the Technical Advisory Group, the TAG, and the Program Advisory Group, the PAG, resulting from that work. Before we begin, I want to say thank you to all of the volunteers who lent their technical expertise by spending nearly a year diving deep into Preschool for All to ensure the promise of preschool is sustained for future generations. These recommendations will help inform a series of conversations with our board and community over the summer, leading up to decisions in August. I just want to say how grateful I am that we are for your work, and looking forward to this presentation. So with that, I will turn it over to the panel. Stephen Herrera, Senior Policy Advisor for my office. Take it away.
All right, good morning. Chair Jessica Vega-Peterson and commissioners, for the record, my name is Stephen Herrera, and I serve as the SafeNet Policy Advisor for the chair, and I use he and him pronouns. Thank you for inviting us to walk you through a briefing on the final recommendations for the Preschool for All Technical Advisory Group and the Program Advisory Group. As we discussed in your individual pre-briefings, today's briefing is a result of a process initiated nearly a year ago to explore and consider potential tax policy changes for the Preschool for All tax mechanism. So with me today are highly skilled and capable partners from ECO Northwest, Brittany Bagent, Camille Trummer, and Christian Gaston, as well as Technical Advisory Group members Dana Hepper, who's the Director of Policy and Advocacy at the Children's Institute, and Charles Reinerson, the Senior Data Analyst and Demographer at Flow Analytics. So not on the dais or behind us are also Rachel Pearl, DCHS Interim Director, and online is Jeff Hawthorne, the county's economist, should any questions come up at the end of today's presentation. Yesterday, in addition to the documents, the materials you got at your pre-briefing, there was a letter that was sent from some PAG and TAG members. You should have gotten that by email. Commissioner, I made sure you got yours this morning. I also have a printed copy. And we also have copies of the executive summary if anyone would like a copy of those today. Next slide, please. Thank you. So our agenda today will walk you through the context of how these two advisory groups were established, the process they followed, their recommendations, and the economic scenarios used to inform their decisions. We'll conduct a look at the next steps in the PFA timeline, including the deadline for submitting additional modeling requests, and at the end we'll do Q&A. I'll now hand it over to Camille Trummer to begin with additional context setting.
Good morning, and don't forget to hit the button. There you go.
Thank you, Commissioner. Thank you, Chair. Good morning, Commissioners. My name is Camille Trummer. I use pronouns like she and her. I'm the founder of Interplay. We're a social impact firm based in town, and I've served as the facilitator and one of the strategists on the consultant team for the Preschool for All Technical Advisory Group and Program Advisory Group. So nothing that I'm about to share is breaking news. This is just context setting to remind you of how we got here where we are today. We can go to the next slide, please. Thank you. So as you all know, in 2025, Multnomah County convened 2 time-limited advisory bodies to evaluate the long-term sustainability of Preschool for All and develop policy recommendations, which we're about to share with you in a moment. Those 2 time-limited groups were the Technical Advisory Group and the Program Advisory Group. The Technical Advisory Group included economists, tax policy experts, and financial modelers. And they really focused on the fiscal, sustainability, and tax policy scenarios specifically. It's important to remember the different scopes for each group. Meanwhile, the Program Advisory Group included early learning leaders, practitioners, and advocates, and their charge was to focus on program impacts on cost, access, and quality. Next slide, please. So let's talk a little bit about the advisory group approach. It was distinct expertise across fiscal analysis and program implementation, which is why the folks that were included in each group were selected for those specific roles in charge. Both of the groups were grounded in both data and lived experience, especially on the program advisory group side. And they were informed by, but very distinct from, the standing PFA advisory committees that have already been functioning. So there was some cross-pollination in terms of recommendations coming out of those standing committees and how they could inform the work of the TAG and the PAG, along with community engagement that was happening alongside the TAG and PAG process over the last 9-ish months. Let's talk about the convening framework. The TAG and the PAG spent a lot of time together for the last 9 months. So we started by defining very clear roles and scopes of work. And as you recall, this was a little muddy in the beginning, but we eventually got there so that the TAG understood their specific charge related to the fiscal implications, and the PAG could help inform the TAG's work by talking about cost, quality, and access, along with other important components like inclusion, right? So we really got clear on role, scope, and a decision-making criteria. We used modified consensus with reservation. I advocated for this so that folks that wanted to convey their concerns had the opportunity to do so along the trajectory of their work. We also had coordinated milestones between the TAG and so each group knew when a particular group was supposed to meet a particular milestone. So we get through the analysis phase, now we go into data interpretation and discussion. And that's when I advocated for PAG members in particular to join in on those discussions so they could inform in real time the data that was being shared by the consultant team with the TAG and basically color on that commentary a little bit. They were also convened around shared values. So from the beginning, we knew that we were going to prioritize accessibility, affordability, and quality. That comes from the PFA plan, so I wanted to recenter that in decision-making and discussion across both groups. This led to the progression of both groups moving from analysis. They were given a lot of data. There was a lot of modeling, so it required a lot of synthesization and discussion. And that helped them move from analysis to alignment. So where are we surfacing emerging ideas and some potential trade-offs and some things that we want to probe further. And then finally, having them arrive at recommendations, which is where we are today. The outcome is a coordinated set of recommendations that reflect trade-offs. They also reflect some deep concerns, which Dana will address. A lot of uncertainty, given our current economic conditions, and aligned cross-disciplinary input for your consideration today. Next slide, please. This is a visual snapshot of the process. This is a visual kind of calendar or workflow. So as you recall, the TAG was convened back in actually April of last year. So we're hitting that 1-year mark. Meanwhile, phase 2 of our work, which then incorporated the PAG, started really in September. And so that you can see in this visual timeline, we met and we're together every other week for about 2 hours, and there are milestones that were communicated to each of the groups so they understood from a month snapshot what they would be focused on, whether that was research questions and tax mechanisms, community engagement findings, establishing a baseline for research, developing scenarios, part 1, scenarios part 2, because there was a lot of modeling that happened between November and December, and then moving into discussion, alignment, and recommendations in the spring. Meanwhile, as you can see on the board chart here, you are receiving weekly updates from Stephen and other staff. There was also a briefing that was held in November, and now we're here at our briefing in April. Okay? So that's all I have for you in terms of context setting. If I need to refresh anyone's memory about anything else that happened between September or today, I'm happy to do so. Thank you so much.
You, Camille.
I'll turn it over to Dana.
Good morning.
Good morning. My name's Dana Hepper. I'm the Director of Policy and Advocacy at the Children's Institute, and I had the pleasure of serving on the TAG over the last year. I want to give a big thank you to Stephen and Camille and the Echo Northwest team, who just did a beautiful job staffing us and answering our array of questions and managing our conversations so that we could get to this report work product in a timely fashion. I want to give just kind of a headline to the set of recommendations, because the report is filled with a lot of really beautiful and compelling charts that kind of predict the long-term stability of the program. And I think when we see those charts, we think like, oh, those are hard data, facts. And I think our persistent theme through the conversations was how many assumptions are built into those charts that we don't yet feel like we have confident answers to. And so the charts, I think, our brains and the way we've learned is like, oh, chart, fact. But I want all of you, as you dig into the findings and the details of this report, to hold those charts with a grain of salt, because there are so many assumptions baked into them. And the theme I think you'll find in the recommendations is we have an opportunity in the coming years to move from assumption to more confident information and facts as the program moves toward universal that really will help you know with more confidence about how your decisions around revenue will impact program stability over time. So that's kind of the recommendation theme. Next slide. So the first recommendation, thank you, you are already underway with, is to commission a preschool cost study. So I think you've already allocated resources and hired a contractor that will bring you back stronger data on the recommended cost per child, which is obviously one of the largest drivers of the overall cost of the program and therefore the revenue needed for a sustainable program. So thank you for doing that work. The second recommendation also relates to a huge cost driver of the program, which is how many children do we estimate will be in Multnomah County and how many of those will participate in the program. So the Preschool for All budget had been operating off of some numbers from the Portland State University Demographic Center, which is, you know, Portland Public Schools uses them. I think it's a common center from which to get data. And we were estimating about 14,000 children in Multnomah County by 2030. We saw some data from our demographer that you'll look at here that was on the committee with us that said, well, maybe we'll have more like 10,000 children in 2030. That's a huge difference. The difference was big enough that we were like, how can two intelligent sets of humans come up with such different data? We think there are two things here. One, maybe we just get a third opinion and see if, you know, that tilts us one way or the other in terms of estimating future number of children and participation rates. But I think another thing is as we get toward universal, you won't have to guess. You will know how many children there actually are and how many of those are participating. So I think some of this can come through better data and some of this can come through time. We're not that far away from our universal target. And that will give us much greater confidence in estimating long-term costs in terms of the number of children. The third recommendation is to delay the scheduled bump in the high-income earners tax. You know, and this was really driven by that first year of revenue in this tax came in so much higher than anticipated. Remember, we were still kind of in COVID and in ARPA land, and that just really, I mean, no one could have predicted what that was going to do to our economy and to tax revenue and inflation and everything else. What a chaotic time. And so that provides the program with a little bit of a buffer that the committee agreed that given that kind of buffer that's currently in place and all this data that you are in the process of collecting, that we felt confident with a 2-year delay would still leave the program with a level of stability to move toward that universal goal. There were some members on the committee that wanted a 3-year delay. There were some members on the committee that wanted no delay or a 1-year delay, but that 2-year delay seemed to be the thread the needle number that led us to a unanimous vote on that recommendation. And it just gives you the time to do this data collection and analysis that you need so that you can make that next decision in 2 years of how you want to proceed at that time. The fourth recommendation is to establish a rainy day fund with a rationale that undergirds the size of the rainy day fund. So currently the program doesn't have a dedicated rainy day fund. It has a reserve of money that has not been spent to operate the program, but we're really thinking about a recession. This is not a program that easily scales, right? You can't just be like, okay, we're gonna cut the funding by 20% and then next year we're gonna increase it, right? We're talking about brick and mortar buildings, physical infrastructure, workforce capacity. This is a very staff intensive kind of work. So stability is king in this sector if you want to create and stabilize a universal program. And because, you know, we see this Oregon statewide, we're a heavily income tax reliant state. This program is an income tax reliant program. Those income taxes tend to fluctuate with recession relatively significantly, that there should be some thought put in by this body to determine what size of a rainy day fund would allow us to anticipate stability of this service through a, you know, average/larger size recession that we don't know when it will come, but we know it will come at some point, and we should be ready for that moment. And the fifth recommendation is kind of stay the course on our path toward universal. This is the will of the voters, and it will provide us with the demographic information we need to better assume long-term costs. So those are the core recommendations of the TAG. Next slide. We also looked at some of the proposals from this body for consideration that we did not recommend moving forward with. So one was indexing the tax to inflation. The TAG did discuss this recommendation or this question extensively, and we took a vote, and the committee voted unanimously to not move forward with indexing. As you can imagine, one of the reasons to not move forward at this time is just the uncertainty about the predictions and the significant impact this has on the revenue. With the uncertainty about the predictions at this point in the development of the program, it felt not prudent to move forward with this now. Like, get the numbers, understand the cost model, understand participation rates and demographics, and then in a couple of years when you have better data there, then the commission will be able to look at the revenue source and decide how to proceed with the data that you need to ensure sustainability, but you just don't have that right now. So it's not prudent to make a substantial change to the revenue without that information. In terms of establishing a credit, there just wasn't a lot of appetite for digging into this. It seemed like it could be a lot of administrative work for a low impact, given that the population who lives outside the county and works in the county and has a 3- and 4-year-old and makes enough income to pay this tax is going to be a very small population for a potentially administratively clunky execution. So we didn't have a champion for that proposal on the TAG through our process. And then finally, some kind of cost share or copay for the 10-hour day was discussed. We really leaned heavily on the experience of the state agency that oversees early learning and care, Department of Early Learning and Care. We have a program in that agency, employment-related daycare, that does have a copay structure. And again, there it seemed like the administrative complexity of implementing a copay structure combined with the low revenue expected to come through copays made it seem like the juice wasn't worth the squeeze. It would require extensive documentation from families, which would be a barrier to access the program in order to determine whether a family needed to pay a copay or not. Documentation that we don't have to collect now at that level of extensiveness and validity with the universal program. Depending on who collects the copay, if the county collects it, you have to consider county administration and overhead. If the provider collects it, you have to consider compliance. So like, is the provider actually able to get the copay from the family? Do they have the infrastructure to follow up with that billing? And how much of the copays do they not collect? And then if they're not collecting their copays, it's just coming out of providers' bottom lines. And then when the state looked at kind of maximum level of copay they could access on a $500 million childcare subsidy program, they found it was like $15 million. So that's where we were like, is the juice even worth the squeeze? If we're collecting a copay, how much is it going to raise versus how much administratively is it going to cost to establish and execute and create barriers to access for families. So I think the last couple things I'll say are that this process with Echo Northwest has resulted in the creation of a much more dynamic cost modeling tool than you've had in the past that will help you, I think, plug in this information as you gather these answers and allow you and inform your decisions moving forward. So I think that's a great tool that hopefully this body will continue to use to inform ongoing decision making. And finally, I really want to encourage you to review the recommendations of the PAG that are embedded in the report as well. These are essential for program sustainability, less from a financial standpoint and more from a provider standpoint. Have we created a program in such a way that allows our providers to stay in this sector, to hire and retain the staff that they need to serve children well, and to create kind of that provider stability? So encourage you to take a deep look at those as well, even though I'm not doing a deep dive on them in the presentation. Thank you.
Thank you so much, Dan. I really appreciate all your review of the recommendations.
Next slide, please.
Good morning, Chair Vega Peterson and Commissioners. I'm Charles Reinerson. My pronouns are he and him, and I've had a long career as an applied demographer, mostly in Oregon, but also in California. I've been asked to walk through this one slide. You heard Dana talking about assumptions. Well, there's lots of economic assumptions. These are the demographic assumptions. 2025 recently ended at about 6,900 births in Multnomah County. That was the third consecutive year that we had roughly that number of births. That's down from about 10,000 in the peak in 2007 and 8,000 in 2019. So that's the most current number, close to 7,000. So the demographic scenario in the modeling assumes 7,000 annual births. We don't expect that number to increase from where it's at now. And then what about migration between birth and age 3 and 4? I looked at the last 3 censuses, 2000, 2010, and 2020, and in each case, the number of 3 and 4-year-olds was about 8 to 11% lower than the corresponding birth cohorts. So births in 1997, for example, compared to 2000, there's net out migration continuously of young children from Multnomah County. And that's not unique to Multnomah County. In all of the major metro areas that I've studied on the West Coast, there's generally more movement out than in between birth and kindergarten, say, just due to decisions that people make about housing. You know, some people remain in the core of the metro area, other people find housing elsewhere. So that's a steady out-migration that we're building into the assumption. So that leaves us with about 6,300 3-year-olds and 6,300 4-year-olds in the future based on current births and historical net migration, which means there would be 12,600 3 and 4-year-olds in Multnomah County. You heard Dana say that this is lower than the previous forecast. This is not a sophisticated demographic model, but it's sometimes simple assumptions are just as good. And I think if PSU or any other demographer were to do, say, a cohort model now using the latest data, I think they would come up with similar results. So the next column, assumptions beyond just the population that are also critical to the future demand for seats. The assumption of participation, 77.5%. So of those 12,600 3 and 4-year-olds, we use the assumption, I think, which is similar to what the county has been using in the previous models of that 77.5% of 3 and 4-year-olds would be seeking preschool, free preschool. So that leaves 9,765 for preschool for all and alternative sites that are funded by state and federal programs. So the next assumption, how many of those sites are going to be funded by state and federal programs? Historically, there have been, I think, closer to 3,000, but that number's been declining. So a more conservative estimate of just 1,500 alternative site seats leaves us with 8,265 potential preschool for all participants. So that's the assumption that's used in the following sensitivity tests.
Yes. I'm curious about the continuing with the 77.5% participation rate when other programs such as Washington DC are at a 90% participation rate, and that's kind of been a standard for projection for these type of universal free programs. Why 77.5?
Dana, again, thank you. You know, we didn't recommend changing that assumption right now in the tag. However, I think it's potentially true that assumption could change over time. And this is the kind of data that, like, as the program moves toward universal, you won't have to guess about participation rates because you will actually experience participation rates through implementation, and then you can adjust that scenario. But I think it speaks to one of the reasons why we're saying don't make a big change to the tax infrastructure, the revenue system right now, because that is a perfect example of something that is like a giant assumption that's built in. So when you look at those charts that are in this report that show like what is our fund balance going to be over time, if you change that number of 77.5 to 90, 89%, which is what DC's participation is for their universal program, that would significantly change the charts and the estimated fund balance. And there's a model that this commission could play around with now to help see what that impact would be. But I think it's a perfect example of something that right now is a significant assumption. But over the next 4 years, you won't be in the land of assumption, you'll be in the land of information and fact based on actual participation rates of 3- and 4-year-olds in the county. And I think whether, for example, does the net migration hold true? I was just at a meeting on Tuesday night, and there was a woman in the room who was like, I have a 1-year-old, we're looking for housing, I'm trying to decide whether we stay here, and she said, I don't know if we'll qualify for preschool for all. And it was a bunch of people in the, you were there too, Commissioner from Edwards, and people were like, it's universal, of course you'll qualify. And she just, even as a mom of a 1-year-old, she hadn't quite sunk in that, like, it doesn't matter if I'm a middle high income person. The design of this program is that everyone have access, and by that time when her 1-year-old is 3, we're going to be pretty darn close to universal, if not there, especially if we have a lower population. We may be there sooner than 2030. And so does that influence this mom and other similar situated parents as they decide where to purchase their house? I think is a outstanding question. We just don't know the answer yet.
Thank you.
Thank you, Charles. Next slide, please. Mike?
Thank you, Chair Vega-Peterson, Commissioners. For the record, my name is Mike Wilkerson. I'm the Director of Economic Research at Echo Northwest and served as a technical lead on this study, supporting the TAG decision-making process and ultimately recommendations. So if we can hop to the next slide. What I'm going to do here very quickly is step through the scope of work and the process that we use to support the TAG. There's a 30-page report and 200 pages of appendices and additional data. And I think just to reiterate, over all of the meetings, the model was evolving. And so there are multiple changes that occurred throughout, and ultimately focusing on what's in the report is the final outputs that supported the TAG decision-making. Previous iterations were helpful in informing the process, but ultimately shouldn't be looked at in terms of those numbers holding true. So with that, we stepped through financial modeling, the economic scenarios, defining sustainability, and then ultimately the tax mechanisms, and we'll step through each of those. So next slide, please. The financial modeling is essentially taking the county's model, which is the chart on the left that you probably had seen many times, looking at the fund balances versus the number of seats. That was an Excel-based model that was updated every year by the county economist and staff, and was effectively a static model. There were hard-coded numbers in there. It wasn't set up to do dynamic analysis, looking at ranges of economic scenarios or different tax policies. And so the first process was to create a dynamic model using code that could analyze different economic scenarios, conduct sensitivity tests, model tax mechanisms, and ultimately create an accompanying model that was a household level model that allowed us to look at income growth over time through the lens of indexing to understand when various households would potentially step over those hurdle rates. And so effectively, we created these outputs that would look at annual operating surpluses or deficits, and then a cumulative fund balance as the main two outputs that the model produced. Next slide, please. From there, we looked at economic scenarios, and the first step was to ground the analysis in a baseline, and that baseline was an update over what the county had previously used, and the TAG looked at multiple considerations. Ultimately, as Charles just discussed the demographics, was to decrease the number of total seats at universality, and then also decrease the total number of seats that are alternatives. And so those two things work in opposite directions. But what was retained was the slot mix in terms of 6-hour school year versus 10-hour mixes. The seat cost growth assumptions and the revenue cost growth assumptions weren't changed in the baseline. Those are run as alternative economic scenarios. Next slide, please. What the TAG ultimately looked at were a wide range of scenarios. And what these are reflective of are not every single iteration, but trying to be reflective of the range of views from lower cost models, which would look at changing the mix into 6-hour days. It would look at another alternative of higher revenues. And so the household model that was constructed looked at the historical growth rates between 2010 and 2019, and that growth rate was higher over that period of sustained economic growth, more like 12% versus the 8% assumption that was used in the baseline. The third scenario looked at higher costs, and so this was informed by some research looking at 5.2 as a annual cost growth rate. And then the ultimate scenario 4 was combining the higher revenue growth with the higher costs. And so again, these aren't every single iteration that was contemplated, but was reflective of a range so that you could understand where those would fall. Next slide, please. From there, a crucial step was to define sustainability. And this was the lens that was used to look at each of the economic scenarios, then paired with a tax mechanism to understand, did it meet the definition of sustainability? The TAG ultimately defines sustainability as the program's ability to operate over the long term without unplanned tax increases, reductions in the number of children served, or emergency interventions. And as Dana mentioned, there was a contingency and a reserve fund that were included in that model. To test those, we created two criteria that needed to be met. The first was a positive fund balance in 2033. And then the second was long-term sustainability, that the cumulative revenues met or exceeded the cumulative expenditures over that long run period. And again, great deal of uncertainty, even getting out to 10 years, even more uncertainty going beyond that. But the goal here was to understand the range of options based on the set of assumptions that were included in the model. Next slide, please. Ultimately, as Dana mentioned, the recommendation was to delay the tax increase through 2029. Each scenario effectively had a mechanism where we would look at a matrix that said, here is the baseline and the 4 economic scenarios, and then each of the tax mechanisms was considered through those 2 sustainability criteria. So as an example, this particular recommendation shows the cumulative fund balance of the baseline versus what the TAG recommended as that delay through 2029. The estimated impact of the delay here is showing $200 million. That would be a 3-year delay. I think ultimately the 2-year delay is what was recorded, and that was more like $130 million. And so effectively, it's about $70 million a year for each year of delay, whether that's 2 years or 3 years.
And apologies, the lower line where it says 3-year delay, that's a typo. It should be 2-year.
Yeah, just to restate, the 3-year delay would be $200 million, so that number is correct, but at 2 years, it's $130 million. And so that's reflected in the report. Next slide, please.
Can you repeat that again? I just want to...
Yeah, absolutely. So I think there was some confusion around what 2 years versus 3 years means in terms of the year of the delay. So a 2-year delay is delay through 2029 rather than through 2030. And so the chart should be labeled 2-year delay rather than 3-year delay. And if it's a 2-year delay, then it's a $130 million reduction rather than what's shown there as a $200 million reduction. Or put differently, it's about $65 to $70 million a year for every year of delay.
Great. Thank you.
Next slide, please. So there are a lot of assumptions in the model has been discussed, and many of those assumptions look at historical rates of growth over long periods of time, but we know that's not how revenue works. It's volatile based on the economy. We are certainly in a long period of economic gain absent the COVID disruption. If we look at modeling a recession, recessions take any number of forms. So here, ultimately, the tag settled on the most recent global financial crisis through 2007 through 2009 and modeled that change in revenue, which you can see here, which is roughly a 30% decrease in the first year, a further 5% decrease in the second year, and then strong revenue gains above the historical trajectory. Ultimately, though, the model of 8% a year is inclusive of recessions. And so this is just a disruption, but the long run trajectory of revenue is the same because of that 20-year period of time that the 8% is looking at is inclusive of recession. So you effectively trend back onto that. So in the long run, there is no hit to revenue. It's just that the fund balance decreases and then comes back at different times. And this was an important consideration for the tag, particularly in understanding how much of a delay relative to when a recession might happen. Ultimately, this form of recession, with all of the economic scenarios and a 2-year delay and even a 3-year delay, did not result in a negative fund balance. So that gave the tag, I think, the confidence to recommend that as their recommendation. Next slide, please. So this is the following timeline, which I think you're aware of upcoming work sessions and ultimately a board vote. I think that concludes our slides and presentation, and happy to open it up for questions now, and thank you for your time.
All right, thank you all so much again for the really hard work and hard thinking and discussions that went into this entire process. Want to...
Chair, I'm sorry to interrupt. Before we go, we forgot to review the timeline.
I was just going to say, I was going through my slides that I have open here, and I'm like, did we talk about that? Why don't we go ahead and bring up the slides again, Emily?
It should be slide 18.
And then just the one previously. We may never see the slide. Anticipate.
Got it. Just waiting for the other hand on the slides.
It was slide 18.
Yes.
No, it's
No.
the slide on the slide deck.
So the slide that Emily is about to pull up just outlines the critical next steps for the Preschool for All timeline following this briefing. So one more up.
There we
Great.
go. Oops. And back. There we go.
Thank you, Emily. So the first action is the May 14th deadline for the board to submit any additional PFA tax scenarios or modeling requests. So similar to the beginning of the tag and the PAG process, the board will have their own process to go through leading up to August, the August 31st deadline. So we then moved to a series of 3 work sessions in June and July. The goal of these work sessions are to finalize specific language for the board actions taking place in August. And then finally, on August 20th and 27th, the board will have 2 rounds of votes that are scheduled for decisions that will come before a vote for the board. And then finally, in September, that's dedicated to the dissemination of tax code changes and operationalizing the tax code enhancements that were approved and voted in by the board in August. So that concludes our presentation of the TAG and PAG recommendations and the financial modeling. So we're ready for your questions.
All right, thank you so much again. Now I can say my thank yous. Thanks to everybody who participated for the work by all the teams on this. And I know that we'll have lots of questions. I will just say regarding the timeline, I think I've been reaching out to all of you about, if you think this timeline and this calendaring works. I've heard some feedback like maybe we don't need as many, so just we can still have some conversation about that. And then But the end of August for any action we take, that is the key piece that we need to look at. All right, with that, we'll go to the board for questions. We'll start with Commissioner Singleton.
Thank you, Chair. I also want to thank all of the PAG and TAG and Camille. I was able to watch most of the meetings, so just want to highlight how awesome your facilitation was. Wrangling the definition of sustainability was something to behold, so just appreciate you. There's a couple of places, I wish there had been more iteration between us. I think some of the assumptions, and we talked about this at one of our work sessions as a board, I actually don't subscribe to making poor people prove they're poor, and so my cost-sharing scenario, I think, was analyzed in a way that I didn't actually want it to be set up. So that'll be something I'll look forward to working with you on to get modeling to look at that in a different way. I think some of the assumptions and the administrative burden are based in a system that was not what I was thinking about. So more to come, I think, on that. One question I had, I know we're looking at 2030, and these may be more for the department, but we're looking at 2030 as the universal, the time we hit universality, but I'm unclear, since we've had some increase in speed, if that's still the target or if we think we're still at 2030 for hitting universality.
I'd like to invite up Denisa McLean, PEL, Director of PEL, and Rachel Pearl, Interim Director for DCHS.
And the question was, is 2030 still the date of when we think we're going to reach universal, or because of the updated demographics, do we feel like that number has, or that year has changed?
Thank you. Chair, Commissioners, Rachel Pearl, she, her pronouns, Interim Director for Department of County Human Services. I think that's a complicated question that I think this next year will determine whether or not we will reach universal sooner. We're in right now doing a formal population assumption study with PSU. So looking at taking into consideration the other information we have and getting the results of that. We have some conversations that are ongoing with some of you and that we've already been exploring around essentially looking at where the gaps are as we move towards universal, where some of the types of seats that we need to expand upon, and being really strategic about this next phase of growth, recognizing that we may be closer to universal than we originally thought. So I think, it's possible that it could be sooner, and I think we continue to see that as our goal. So I think we'll continue to come back and update you as we learn more and have a lot more conversations over the next few months as it relates to both of those things, population assumptions and filling the gaps, and how we're going to do that strategically and in a well-informed and thoughtful manner so that we are actually accomplishing that goal.
Thank you. And I'll be interested, I think early on you had talked about a lot of the early seats were converted seats that might have been Head Start or another funded program, but we're looking at also new preschools, whether they're home-based or facility-based, and that's been another part of kind of the increased seats that we've been able to do. So some of that mix will be helpful as I appreciate us taking down the Head Start or the number of seats that we think the feds and state will pay for, since we're already seeing those decreases. I will say I fear it gets to zero, but we shall see. I think the other question for you all, and I'm trying to understand the 2-year delay versus when we get the results of the true cost of care, and do we have a target date for the true cost of care study at this point? I'm sorry, I should say the results of the study.
Thank you, Commissioner. Yes, the true cost of care study should be concluded by June, and so we will have more information on what that true cost is going to be, essentially, and then those financial modeling and projections will inform, that rate will inform our ongoing projections.
Thank you. That's really helpful. Oh, go ahead, Rachel.
Yeah, I'll just say, we pushed the sort of that study to be done in an expedited way so that you all could have that information prior to making decisions, knowing that if there's a significant change in seat cost, that will change projections, and didn't want you to be in a position where you couldn't answer those questions and make long-term decisions without that. So we anticipate there's going to be a lot of work post getting the results to determine what the long-term impact of any change to seat costs will look like.
Thank you. And I know there's some additional costs when it comes to some of the inclusion work that we've talked about as well. So seeing all of that folded together will be really helpful as you all move those next steps forward. I feel like if I get into any much more, I'll start talking about budget stuff, and then I'll get looks from Jenny over there. So I will just say, I think there's a lot of really interesting things that we can do over this next year to look at shoring up the program, at really improving some of the inclusion supports that you've all heard feedback on, things that Commissioner Moyer and I have been trying to wrangle with you. And then additionally, getting the true cost of care will be really helpful for us for decision making. So I will end with that so that I don't get in trouble and start talking about next year's budget. Thank you.
Just wait a week. Commissioner Broome Edwards.
Thank you. I want to thank department's work and also all the individuals who served on the technical advisory group and the program advisory group for sort of wrestling through with the data and coming up with a set of recommendations. And wrestling with data, but also emerging data, which is always very challenging. I appreciate the statement that was made early on that just acknowledging the lack of confidence and all the assumptions and the information based on the newness of the program. That's a real thing, and I think it's good to acknowledge that, because then it doesn't become later, you've said this with certainty, and now, we have a changed set of circumstances. So I appreciate that, because I think it's important that we just keep that in mind. And it's not at all unusual in the establishment of a new program, having set up new academic or educational related programs. I know when you stand it up, there's always those sorts of questions. I'll just give an example. It's the Career and Technical Education program that was instituted statewide. Same thing, like how many classes are high school kids going to take? How popular is it going to be? All those things that just makes it hard to predict. So I appreciate that sort of caveat. I'm really going to focus on the recommendation slide, and I don't know what page number it is. It's the one that says TAG-PAG recommendations. So the first one is Commission of Preschool Cost Study. Commissioner Moyer and I brought forward a resolution in early February that this commission approved. I am wondering sort of when that will be ready and how it gets integrated into this other timeline, or if at all.
You repeat when what will be integrated? Sorry, I was trying to figure out if you needed me here if I was leaving, and I missed the thing you said.
It's a new program. I'm giving everybody the big aspect.
Just trying to figure out who's answering this question.
It's just when it will be. When do you expect it to be completed, and how it gets integrated or not into sort of the timeline on these other specific recommendations?
Are you talking about the true cost of care study?
Yeah.
Oh, June. They had said.
Okay, and then, but how would it get integrated into the other sort of, and meshed, and this will be my next question about the demographic studies, but how will it get integrated into like other new data sets that are coming and the impacts, or is it that the technical and program advisory groups recommendations are sort of in a separate lane? Does that make sense?
Yeah, so, and I think Jeff's on here, but what I can say is if we have an updated information that changes the cost of seats and we have updated population assumptions, those would go into our financial model and determine, which would also be able to be compared to that long-term sustainability that we're looking at, which is how you all are determining what makes the most sense from a decision-making perspective. So I think those different components being put into our financial model, being able to see how that impacts sort of that curve that was shown today and that you've all seen over time. The seat cost, if there's a drastic change, would impact that. And so being able to look at that and also population assumptions, if there's a change there, those two things are going to be the biggest cost drivers for the program and would definitely be information I would think you would all want to consider when figuring out long-term changes to any revenue source.
Okay.
Could I add?
Yeah, just hit the button on your mic. Dana, the mic, just hit the button. There you go.
Sorry, thank you. In the scenarios that Echo Northwest outlined in response to TAG member requests, one of the scenarios was that high-cost scenario, and that went from taking the annual increase in cost per slot from 4% to 5.2%. And our debate in the TAG, or our conversation, I don't even know if it was a debate, was we are definitely hearing from providers, especially in terms of the full day, like the 10-hour day, full year model, that it's not feeling like the allocation is adequate to cover their true costs. And so but we didn't feel like we had anything to base a different cost per child on. So the annual percentage increase based on some information from other states became our fallback, but a much better scenario would be to actually complete the true cost of care analysis as is underway and plug that number in. Then you may able to go back to the 4% annual increase as is currently projected and let go of the 5.2% annual increase in costs to get better long-term projections.
Great, thank you. Since the demographic forecasting was mentioned, that's where I was going to go next. So this is an issue that I had raised when I looked at just the static nature of the 11,000 and knowing that from serving on a public school board that just across the state, across the country, and in Multnomah County, in most districts, we're seeing declines. That wasn't captured here. And two things. One, oops, if you go back, sorry, go back. Just we can go back to the other slide. I'm just going to stay on this one. One is, I can't tell from the verb commission, does that mean it hasn't yet happened? It seemed like there was like a couple different options of how to proceed, but it would be helpful to get that sort of underway. So as we have this other data coming in, we have that as well. And the second part of the question, not a question, but I guess I'm just going to state that sometimes when it's just a number, it's always subject to, you're never going to hit that exact number. So is it possible that when the demographic forecasting is done, that like, for example, the saturation rate, to Commissioner Moore's point, that we have a range, like we think it's going to be between 75 and 85 or whatever the number is, so that we don't get so stuck on like 11,300. Or is it 200? I can't remember. But there'd be a range. So those are the two-part question.
Thanks, Commissioner. We are in process with the population assumption study. It will be done either at the same time or before the true cost of care study. So again, really important for us that the timeline aligns with the information that you all need to look at when making decisions. So. And as you know, I think, yes, there has to continue to be flexibility in how we're looking at those numbers, because as we know right now, we understand that there's likely more 3- and 4-year-olds right now as we're building this program than there will be later, and then that number is continually changing. So it's not a, it's a dynamic number. It's not a static number, and so we have to continue to build flexibility into the model and how we're being responsive to meet the needs that we have in our community. So it's certainly a complicated equation and something that we're continuing to grapple with as a program.
Great. I'm just going to keep going down this list here. The rainy day fund. I just want to say I think that's a really smart, prudent fiscal step to take. Having been on a school board when there was no state rainy day fund and seeing like cutting programs mid-year when an economic disruption happens, it's very disruptive on a whole host of levels. So I think it's a great idea. I will say I think we should be cautious not to just rename the reserves a rainy day fund, but it should be based on, the size of the fund should be based on economic projections and what we think we really would need for like X amount of time for to take into consideration some sort of disruption. I'm glad to see the focus on universality. Commissioner Moyer and I have submitted an agenda placement request for a gap analysis and recommendations as we get, since it looks like we're getting closer to universality sooner than we thought. And those last seats probably are going to be the most challenging ones to fill, just anytime you get to almost to universality. So I'm looking forward to the work on that and appreciate the conversations we've had to date on that and the department's focus on getting to universality. And then the last, this is not on this page, but on the not recommended, I appreciate and again, I'm going to go back to the earlier comments about the uncertainty and the data and what the impacts are, and the not recommending indexing. I still think this is a basic fairness issue for those that don't have additional purchasing power. They may have more income, but they don't have more purchasing power. In fact, they may have less. In my pre-brief, I believe this, Jeff Renfro said that if there's no indexing in the future, 40% of the joint filers will be paying the tax. Stephen, you were there. I think that's correct.
I was at the pre-briefing with you, but I was looking at my laptop when you just asked that question, so I apologize. Can you repeat the question, please?
I think it said without indexing, in the future 40% of the joint filers will be paying the tax. I'm seeing there's a nod. Actually, I think it was Christian Gaston who said that. Sorry. It's not that you and Jeff look alike. I just forgot.
Chair Vega Peterson, Commissioners, my name is Christian Gaston, use he, him pronouns. Yes, so we had shared with the TAG a simulation over time of the growth of taxpayers, the proportion of people who are paying the tax with and without indexing. And it appears that in 2040, with static thresholds, up to 47% of joint filers would be subject to the tax versus 37% with indexing. With single filers, the participation's lower. It's 17% versus 9%.
Great. Thank you for providing that. So in essence, without indexing, you're broadening the base beyond sort of the very highest taxpayers. Great. So those are the only questions I have. Thanks for all the work. I really appreciate the time spent diving through it. And to answer to your question about how much time we need. I think anytime there's a new program and there's uncertainty, better more time than less. So I'd be inclined to keep our work sessions, and if we don't need them, that's great. But I think it's useful also to share out the information with a broader group of people.
Great, thank you. Commissioner Jones-Sixon.
Great, thank you, Chair, and thank you all from the PAG and the TAG for just your contributions in 2 hours every other week. Thank you. The recommendations, the report is extremely helpful. I just have three questions. One question for the PAG under access. We've heard from community members as far as like open enrollment and timing regarding eligibility. Is that something that you discussed? And do you have any recommendations? I haven't read through the full report yet. And your mic's off, Dana.
Yeah, oh, thank you. Commissioner Jones-Dixon, Dana Hepper from Children's Institute. I didn't attend all of the PAG meetings. I attended more of them as we got closer, so I don't know if that exactly was a recommendation. I do think generally as much rolling admissions as possible is better for programs and better for kids. There will always be families who move in and out for a variety of reasons, and to be able to kind of be regularly filling those slots with families who come into our community or come into a neighborhood and need to change placements is good. I appreciated Commissioner Brim Edwards' comments about the need for kind of a range. You know, I think there can be pressure in the early learning world to fill 100% of your slots. And if you think about housing as kind of an ancillary, we don't want 100% of housing units full, right? Because that increases the cost pressure on those housing units and means that people really don't have the opportunity to move and find a new place. So you want more like 95% of your preschool slots full potentially, so there's a little bit of give. So if there is a need for someone to come into a classroom placement, that you have an open spot for them in a scenario where we have state mandated ratios that also support child development and best practice. If you have every single classroom completely full all the time, then you have no opportunity for people to change and move and go to a different neighborhood and have the opportunity to have their preschool setting close to where they live and build their local community, for example. So all that to say, I wasn't a part of those conversations, and in terms of global thinking about best practice, I think definitely having rolling admissions as much as possible with, of course, as I think the county has done really well, really intentional community-led outreach to make sure that it's not kind of first in line because you're the most privileged and most ability to track and have English as your first language, and so you get first in line. Yeah. You still want intentional community-grounded outreach into the communities for whom preschool makes the biggest difference in terms of kindergarten readiness and family stability, but an ability to continually enroll children, I think will be beneficial to families and programs.
Great. Thank you. That answers my question. And then my final question has to do with just, I guess it's a Charles question, demographers, just around, are there pros to distilling or looking at specific districts? For example, as far as like the numbers of toddlers in East Multnomah County and Gresham specifically, there was a report from the car seat manufacturer saying that Gresham is like it's growing its population as far as we have the most toddlers per capita in in Gresham specifically. Should we be looking at that information, or should we be looking at the county line, or what are the pros and cons to that?
Well, I suppose for the overall budget, it would be countywide, but yeah, it's true that the East Multnomah County districts have more children per household than the closer in neighborhoods, and hopefully the location of providers reflects that. I think, my kids grew up in David Douglas district, and I've worked with Reynolds and Centennial districts, and those districts also, just in terms of the birth rate, they're still higher than closer in, but they've been declining as well since the peak 10 and 15 years ago.
Information power. Thank you. That answers the question. Looking forward to the continued direction.
Great. Thank you so much. And just again, huge thank yous to everybody. I think, this is really, really important work for our community, for the county. It's a new program. It has a lot of attention on it. And we also know that the impacts that it's having on already thousands and thousands of children in our county, families, workers, providers, has already been so immense. And so making sure that we are continuing to be good stewards of this work. Oh, I'm so sorry. Go, Commissioner Moyer, go ahead. It's the end of the line, and and Commissioner Jones-Dixon, I know you have to step away, so, all right, Commissioner Moyer, I'm sure you have plenty of questions. Go for it.
That's right, I do. I do have a couple of questions. One was in the conversation about a rainy day fund. What was the thought about how? It doesn't specifically say, but I'm just curious about the conversations, like How large should that be? What factors should we be considering based on an income tax being fairly volatile, and the fact that we typically, our contracts are year-long contracts with providers? What would that look like if we were to be fairly conservative in a not wanting to disrupt a year approach?
I don't think that question was answered or talked about deeply in the TAG and PAG meetings, but I do think that's something that our economist, Jeff Hawthorne, can give you some further information on. Jeff, anything you want to say to illuminate, or should we get back?
Jeff Renfro.
Jeff, I'm sorry. Jeff
Sure.
Renfro.
This is Jeff Renfro. Apologies for not being there. I had to work from home unexpectedly today. So Commissioner, I think it's something that we can talk about. I think when we've thought about reserves at the county, it's a combination of the specifics of the revenue source. So I think if we're comparing an income tax versus a property tax, an income tax, you'd want a bigger reserve available just because of the volatility related to it. And then I think we'd also want to think through the amount of risk associated with a sudden change in our revenue expectations. So, if we feel like this program, it's really necessary for us to be able to make a commitment to our providers for a long period of time, and there would be sort of disastrous consequences if we weren't able to fulfill those commitments, then we'd want a bigger reserve as well. So I think nature of the revenue source, and then the appetite for risk or the potential negative consequences associated with having an insufficient level of reserve, we kind of put all those things together and would arrive at something that could be a percentage of expected revenue, or it could even be the reserve needs to be able to fund like a certain number of months of operations. So we can have a bigger discussion about that.
Thank you. I wanted to ask about, we received a letter from a group of individuals who served on the TAG and the PAG, which I would characterize as wanting to frame the report. And I'm curious, I think, Dana, you're on this, so I'll give you the opportunity, if you're willing, to kind of explain this, this letter and the purpose of contextualizing the report for us.
Absolutely. Thank you, Commissioner Moyer. So, I think I gave some of these caveats in my description. I think as we went through as TAG members and PAG members and read the final report as written, everything in the report is accurate and true. But I think the piece that didn't come through quite as crisply, and we wanted to make sure this body truly understood, is just what I said earlier, which is how many assumptions that we didn't feel a high level of confidence in fuel the charts in the report. And so that was what we hope to illustrate with more specificity here. Hopefully, as folks look at this, it reflects the conversation. Like if you went back and watched each of the videos, as it sounds like some of you have, good for you, it's a lot of time. Hopefully this would, in your perspective, reflect the discussion. So it was just adding some nuance to the true statement. So for example, when I went back and read the report, the first finding is like, under all of the scenarios we studied, the program is financially sustainable. And that is a true statement. Under the scenarios we studied, the program is financially sustainable, including under a variety of revenue scenarios. However, the cost per child, we didn't feel confident in that. The number of children, we didn't feel confident in that. The percentage participation, we don't feel confident in that. And so if you change any of those numbers, that first finding could become completely untrue. And that is a very possible scenario in our perspective. And so we really wanted to make sure that high-level takeaway was shared by this body, which is why we drafted a supplemental, hopefully complementary letter.
One of the conversations, for anybody who was there or participated, I too watched some of the meetings. My staff watched all of that. And there were conversations, one about, I think it came up during the indexing conversation, where there is a pro side to expanding the number of individuals who pay the tax. Some people think that, more taxpayers paying, more skin in the game, it's more shared commitment, but also, is it accurate, and maybe this is a Jeff Renfro question, is it accurate that when you expand the tax base or, the number of individuals paying, it in fact stabilizes the revenue over time? Is that accurate?
Yeah, I'm not sure I would say it stabilizes it, but it maybe makes it more stable because you would be adding more taxpayers who get most of their income from just like the normal go to work, collect a paycheck, and it would sort of dilute the impact of the high percentage of capital gains related income we currently have in our taxpayer mix.
I really appreciate pointing out the kind of significant level of unknowns. And I don't think it was for a lack of doing homework. I think there's legitimately things we don't know that will become clearer. One of the things that I'm interested in, maybe this is that follow-up of like modeling that we can do. I'm very interested in, if we were to have a Great Recession, number 2, which I hope does not happen. I certainly hope the doom loop just never materializes. But if that were to happen in the short term, what would that do? I'm very curious about, what a positive outcome I think we're hoping for is that families don't move out to the same rate they have because we're offering this benefit to 3- and 4-year-olds. We're currently, I think had a projection of like 700 families from, birth numbers to living in Multnomah County. I'm curious, about that. But I guess my question would be, and I don't know if it ever got to modeling, but were there scenarios when these things were being debated of like, well, if this happened, where in fact our revenue would be inadequate for a period of time? If stars aligned, not as we may hope or not hope, but are there scenarios of things that are possible? I don't know if they're probable, but they are possible that would cause us, in fact, to be running it in the red.
Yeah, thank you for the question, Commissioner Moyer. In the range of economic scenarios that were contemplated, at one point we were looking at more seats, and whether that is through higher participation rate, less outmigration, different changes in birth rates, they all ultimately result in the number was the main piece. The lever of how that came about was uncertain. So if we go back in some of the documentation, there was, I believe, 1,000 seats more was modeled at one point, so there is some existing work that's done in that space. Ultimately, the form of the recession that is in the final report is the global financial crisis model. And so we don't have the global financial crisis model and the higher seats, because at that time the form of the recession was different. So again, this is all we've run so many scenarios. So let me try to answer, comprehensively. We do have an understanding of what the per seats piece is, but not also with the recession. So But with the recession, we do have some certainty that the global financial crisis, with each of the scenarios and a 2 or even a 3 or even a 5-year delay, wouldn't tip into the cumulative balance going negative. It's very dependent on the rate of the recovery. So it's not as much how much does it go down, it's that in the global financial crisis, we saw a big upswing. So in the 3rd year of that recession, you actually had an increase in revenue over the trend. And so that drove a lot of that. So with any recession, the city economist, for example, has stated that he believes the city is in a recession. And so what we might be seeing today is what a recession looks like, and growth could be higher later. The recession could take a very different form. These are all, historically very different events. And so the one we modeled was 2 years of precipitous decline and then a big recovery. And in those instances, a 2 or a 3 or even up to a 5-year delay in the rate didn't drive it negative.
And that, again, was with a lower seat assumption or the 11,000 seats?
With the 11, so that's the challenge is to look at your question, we would need to go back and run a different scenario. So there is, I believe, an understanding of a recession with the higher, but it was a different form of a recession that was a big drop and not a quick recovery. So that's probably more of a conservative approach. I believe there might be some documentation of that in some of the previous analyses.
Okay, thank you. I think, my last comment would be, this was very helpful for me in framing the context we need to look at as we decide if now is the time to make some decisions, how far out should some of those decisions have implications. I caution external forces that are very interested in some really significant reform. Maybe that scenario will come to pass, maybe it won't. But I do think that there's a lot here that indicates that, one, we have information we need. I strongly have discomfort working off of market rate studies because the market is, by definition, not a sustainable market that people can afford. And so it is not that closely associated with cost. I don't know what the true cost of care model will come back at. I have a gut instinct it's not less, but it could be. That concerns me to not base projections. So I'm very much looking forward to having that and being able to play some of this out using that. I also have real concerns, at least short-term, around inflation. And, that's anybody's guess. Tomorrow it could be something different. But the thing that I really appreciate is that I feel like the TAG and the PEG really grappled with some very hard questions that now we need to incorporate in our conversation. And I certainly hope that those who watch this understand that part of the work is making sure you have the right information to the best of our ability before we can act with confidence and still be good stewards of this program. And I appreciate, that is the message I got from this. So I appreciate that level of work. And I appreciate being, I think, steered in the right direction on some of the conversations that we need to grapple with. Thank you.
Thank you, Commissioner Moran. Sorry again for just trying to end. Yeah, we are losing folks. So I just want to sum up. I started to say my closing remarks, but you got the gist. It really is about how we can make sure that we ensure the sustainability, the viability of such an impactful program. And I just want to, and it is hard work, and there's areas of disagreement, and trying to get to recommendations, knowing that there's, more data that is always needed, that it is still a young program. And so, some of these things we're just going to learn from time, but it's just trying to help us as we are making decisions about the future of this program in the best way possible. I just want to just appreciate all of the really the integrity and the thoughtfulness which everyone in this process brought to this work. So thank you so much. Thank you for being here today for this long session. I will just remind the board that May 14th, 1 month from today, is when modeling requests need to be submitted to the budget office and the preschool and early learning division so that they can have those modelings, those case studies ready for our consideration, along with the cost of care information and the population study information, so that we really have the most robust information as we continue this discussion as a board in June. So thanks everyone so much for all the great work today. That concludes today's meeting. Our next meeting is scheduled for Thursday, April 16th at 9:30 a.m. There being no further business, we are adjourned.